Lorata-D is a combination medication that contains loratadine, an antihistamine, and pseudoephedrine, a decongestant. It is used to provide relief from seasonal allergy symptoms such as watery and itching eyes, runny nose, and sneezing. Pseudoephedrine helps to relieve a stuffy nose, promote sinus draining, and improve breathing. It is important to note that this medication is not recommended for use in children under 12 years of age due to the high amount of pseudoephedrine. The typical dosage for adults and children over 12 years old is 1 tablet every 12 hours. It is best to take this medication with a full glass of water, and it can be taken with or without food. It is important to follow the recommended dosage and not to exceed the maximum daily dose. Be sure to consult with your doctor or pharmacist for the best time to take this medication based on your individual needs. When taking Lorata-D, it is usually recommended to take it once daily, or as directed by your doctor. It is important to take it with a full glass of water and to swallow the tablets whole, without crushing or chewing them. This helps to ensure that the drug is released into your system gradually and reduces the risk of experiencing side effects. It is important not to increase your dose or take Lorata-D more often than directed by your doctor. Additionally, it is advised not to take this medication for several days before allergy testing, as it can affect the results. If you have any questions or concerns about how to take Lorata-D, it is best to consult your doctor or pharmacist for more information. Some common side effects of Lorata-D may include dry mouth, mild stomach upset, trouble sleeping, dizziness, headache, nervousness, loss of appetite, or thirst. If any of these effects persist or worsen, let your doctor know. If your doctor has prescribed this medication, it's because they believe that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as fast/irregular heartbeat, uncontrolled shaking or tremor, mental/mood changes, such as confusion, or difficulty urinating. Seek medical help right away if you have any very serious side effects, including seizures. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, reach out to your doctor or pharmacist for guidance. As for the best time to take Lorata-D, it's important to follow your doctor's instructions. Typically, it is taken once a day with or without food. The dosage will depend on your medical condition and response to treatment, so make sure to take it exactly as prescribed. Remember to keep track of any side effects and report them to your doctor. Before taking Lorata-D, it is important to inform your doctor or pharmacist about any allergies you may have, especially if you are allergic to loratadine, desloratadine, or other decongestants. Additionally, it is important to discuss your medical history, especially if you have kidney or liver disease, problems urinating, high blood pressure, diabetes, heart problems, thyroid problems, or glaucoma. It is important to note that Lorata-D may cause dizziness, and the use of alcohol or marijuana may increase this effect. It is advisable to avoid activities that require alertness until you are sure of how this medication affects you. Older adults may be more sensitive to the side effects of this drug, which can increase the risk of falling. For pregnant women, the use of this medication should be carefully discussed with a doctor, weighing the risks and benefits. It is also important to consult a doctor before using this medication while breastfeeding. As for the daily dosage and optimal timing, it is best to follow the instructions provided by your doctor or pharmacist. It's important to be aware of potential drug interactions when taking Lorata-D. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It's important to also check the labels on all your medicines, as they may contain similar ingredients. Additionally, Lorata-D may interfere with certain lab tests, so make sure lab personnel and your doctors are aware that you are taking this medication. It's important to note that loratadine is very similar to desloratadine, so do not use medications containing desloratadine while using loratadine. And remember to ask your pharmacist about the safe use of any cough and cold products while taking this medication. If someone has taken too much Lorata-D and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, you can contact a poison control center for assistance. In the US, you can reach the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include irregular or unusually slow or fast heartbeat, unusual nervousness or excitement, and seizures. Always take Lorata-D as directed and never exceed the recommended dosage. If you suspect an overdose, seek medical help immediately. It is important to note that Lorata-D should not be shared with others. This medication is specifically prescribed for the individual it is intended for, and should not be used by anyone else. Sharing medications can lead to serious health risks and should be avoided at all costs. Always consult with a healthcare professional before using Lorata-D or any other medication. If you forget to take a dose of Lorata-D, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Lorata-D at room temperature, away from light and moisture, but not in the bathroom. Keep it out of the reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard it, and you can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.